Gladys Berejiklian has to go. She is the worst possible state leader at the worst possible time. The super spreader, if you like, in a pandemic of high-level incompetence and intellectual dishonesty. About a week ago now, I did my first number crunch on COVID cases in New South Wales. I used a systems engineering approach to try to get to the bottom of just what was going on numerically. There's a link just up there if you'd like to check out those reports. It's in two parts, okay? And I will stand by while you bring yourself up to speed, but the short version is I determined at that time that reported cases per day were growing at 4.75% on a daily basis. And that's based on a rolling average of cases per day for each week of this crisis. We've had a new week of data from New South Wales Health now. It's Saturday the 28th of August as I record this. And based upon that new data, since the 17th of August, when the average new cases per day for that week in New South Wales was just 97, we've grown to 895 on average for the week ended today, Saturday the 28th. And I know we have had a couple of blips there, a couple of records, if you like, greater than 1,000, but the average has been 895 for the week ending today, the 28th. And this represents a growth of roughly 5.4% per day in new cases for those 6 weeks where we've got robust data. The model is evolving as the data comes in, right? And you've got to expect it will move from here to there in time, but you have to remember that detected cases is always going to be less than the actual number of cases out there in society by definition, like it just has to be because we can't find them all. And there's no upper limit to the mathematics of the compound interest, the exponential growth of COVID, right? But there are some hard limits in the physical world, and at this point, they will be quickly reached, certainly by Christmas. We've got growing vaccination rates on one side, which is a little bit like cooling the reaction off, if you like. And on the other side, we've got the virus and its proclivity to breed and reach new hosts. And nature is pretty innovative like that. The ability to test the population is going to be overwhelmed fairly quickly. And ultimately, nature is, of course, going to run out of new hosts to infect, and the weather could mitigate or militate, we don't know yet, but it will get warmer and that will probably have an effect as summer comes down upon us. But the other pandemic, okay, that of political incompetence, it knows no such boundaries. New South Wales Premier Gladys Berejiklian, Bachelor of Arts, the Clayton's degree, she was asked about a fortnight ago if curfews were on the table as a COVID-19 countermeasure for New South Wales. And here's what she said. If we thought that they would have a significant or even marginal impact, of course we would do these things, but there is no evidence to suggest that is the case. It's highly doubtful that any new curfew supporting evidence has come to light in the intervening time, I'd suggest. Dr. Kerry Chant, the state's Chief Health Officer and weapons-grade Berejiklian brown-nosing bureaucrat, said she strongly supported the new measures to slow the growth of this escalating outbreak and give us time to vaccinate our population to save lives and prevent hospitalisations. SMH there, Costello's cockheads by any other name. There is no plan. Clearly, okay? Certainly these actions are not consistent and they're not based seemingly on all that much evidence, but rather on spin-type imperatives to be seen to be doing something, like anything, no matter how ineffective or not evidence-based it may be, such as cracking down hard on the non-existent hordes of COVID-carrying rule breakers allegedly damning society into some nightmare hellscape where zombies run amok. I'm only just paraphrasing. The Premier is quite keen to shift the blame towards those non-existent lawless hordes, right? Most of us are just sitting here in our fat caves waiting for the eye of the shitstorm so we can change direction. These clowns at the top are obviously running this whole show on the fly, in close consultation with their spin doctors, as opposed to, actual doctors. They've got to be seen to be doing something, like, even if it won't work, because, politics. They're playing the game of COVID with half a deck, in other words. Australia's most useless health minister, Brad Hazzard, announced today, happily, that people can get married again. Yes, that's great news from this coming Friday. Meanwhile, New South Wales Ambulance Commissioner Dominic Morgan told the press the past 3 days have been the equivalent to the busiest New Year's Eve ever for paramedics. Last night was the second ever status 3 alert that New South Wales Ambulance has ever had. That means that we are seeing impacts on our ability to respond. Translation, okay? The health system is groaning under the strain, but you can get married from Friday. This is what happens when you put people in charge who see only spin. Today, 12 local government areas in Australia's biggest city, like millions of people, are living under an wholly ineffective, completely arbitrary curfew in the poorest parts of the city, defined by some bullshit local council boundary. These poor souls are allowed to leave home, like many live in cramped apartments, and they're allowed to leave for only 1 hour a day. It's ever so slightly Berlin, like 1970-something, east of the big wall, isn't it? In many cases, these people have neighbours just one street away who can leave home to exercise for as long as they want, just because their bins are collected by a different fucking council. Which seems quite unfair to me. It seems ineffective in the battle of humanity versus virus too, let's not forget that. We are definitely not all in this together anymore, Sydney, like we're just not. But we are all required to remain in our local government areas to shop for food, for example, plus 5 kilometres outside the wall. In my case, my LGA extends 25 kilometres to the north. That is functionally insane. Plus, there's no scientific evidence that a curfew is in any way effective against COVID-19 as a prophylactic, right? But it has effectively criminalised being outside your home between 9 p.m. and 5 a.m. in those areas, even if you are just going for a drive alone to clear your head because you've been locked up in a cramped apartment with a screaming kid all day and your business is on the brink of collapse and it's all getting just a bit much. In an allegedly free society, this is occurring, right? While useless politicians sprout their self-entitled policy-on-the-fly bullshit on full pay. I could understand that getting to a person. Melbourne epidemiologist Tom Blakely told the ABC in a story published today that countermeasures were about using, quote, every tool in the toolkit. He added, so you pull out your mask wearing, your physical distancing and your closing retail, and when you get to the bottom of the toolkit and you're getting desperate, you pull out something like a curfew. Desperate. You don't see too many politicians dropping the D-bomb, do you? And while we're talking about the fundamental erosion of your freedoms, okay, you now have to carry identity documents in New South Wales and proffer proof of your address upon arbitrary request by police if you just step outside and go for a walk. This is unprecedented in Australia. Like, the cops previously simply could not stop you and compel you to identify yourself on some whim, just because they feel like it. Like, obviously, if you're driving a car, different story. But these punitive measures, right, A, they're not working, and B, they have no scientific justification or basis, and C, they lay the foundation for a fundamental, enduring divide between the citizens of this state and authorities at a time when tensions are already strained. This is the actual Gladys Berejiklian legacy, I'd suggest. The legacy of a piss-weak leader, in other words. The legacy of a leader hell-bent on propping up her mates, the property developers and others, by giving them a free pass just to press on in a time of crisis. Where's the evidence for that? I'd suggest that it's vitally important for the bulk of citizens in any free society to buy in when governments make decisions, especially the hard ones. A bit of robust evidence and some straight talk, dash of intellectual honesty, pinch of actual fairness and parity. It's not that hard, really, except for a politician. But personally, I cannot chow down on this useless Premier's crackpot prophylactics. I'm a facts and evidence kind of dude, really. It's a living hell, plus it's a character flaw, I admit it, but I suspect I am not alone. There are still some of us out there, surely. Now, just to be clear, like crystal, I am definitely not saying break the rules. Do not break the rules. You have to comply with the law, right? It's not optional, compliance. But you are also absolutely allowed to advocate strenuously for sanity, competency and effectiveness in our so-called leaders. That's what being in a democracy is all about, and that's all I'm advocating here, unambiguously. Just remember, soon enough, you will get to vote. Don't miss this opportunity, I'd suggest. Earlier, Ms Berejiklian urged people in New South Wales not to become fixated on or panic about the surging case numbers. That's from ABC News a week ago. And I'd say, well, why make it the friggin' headline every day at 11 a.m? Gladys Berejiklian is the cause of this fixation. It's wholly pornographic. This Premier is faking it for the cameras on a daily basis, just like Stormy Daniels, only not even vaguely titillating. It's undignified and ineffective, and I am not the only person who thinks this. I go to the press conference almost daily. Half the problem is they understand it is being broadcast live, so she is playing to the cameras in a far more significant way compared with a standard press conference. As a reporter, we can never get a straight answer because she is playing to the cameras. She contradicts herself repeatedly, day after day. The actual health orders half the time don't match what she says. I got that by SMS shortly after my earlier COVID assessments about a week ago, and it was a real blast from the past. From someone I will not name, mainly because it's a venial sin to be identified with what you actually think if you work in the mainstream media in the news domain. I've known this person for several years and we are hardly friends, but I do respect him or her as a hardcore news operative. That's an honest and upfront appraisal from that person about how Gladys Berejiklian rolls at the coalface. If New South Wales has had to go down this journey the earliest because of the size of our state, because of the way the outbreak has grown in New South Wales, so be it. No, sorry Gladys, we are in this position, personal opinion, because your hubris was out of control early on. At least that's how it seems to me. You took advice from business lobby groups and dismissed science-based advice to lock down hard and lock down early. And that, to me, is unforgivable. And you spinning it in this way is wholly disingenuous and intellectually dishonest. Just my opinion, but hey. If you took the health advice and you refrained from locking down early because of that advice, then just release it publicly. All the correspondence from New South Wales Health to you for the months of May, June and July. That should be enough. Do that and all this public speculation will just evaporate and you will be vindicated. One of Australia's best independent reporters, Michael West, actually requested the health advice under freedom of information. He's still waiting for a response, apparently. And now we've got police and the army door-knocking the citizens and handing out fines that ordinary people cannot afford and can't afford to fight in court either for breaches of health orders that can't work because they're not evidence-based. Because Gladys let the genie out of the bottle. Thanks a lot. Like most people, I have a contract with society, a functioning contract. And this kind of bullshit is not in it. I did not sign up for this, and I can't be the only person who feels this way. On Thursday, New South Wales Chief Health Officer Kerry Chant said authorities had seen, quote, some deterioration in individual behaviour, quote, because people are obviously feeling so tired and frustrated, end quote. I'd suggest that's just bullshit spin too, because if you have a population of 8 million anything, you can cherry pick any outliers you want in any domain to pump up any crackpot case you wish to prosecute for the Premier at a press conference. But social scientist Julie Leask, she told the ABC there was no evidence of people in New South Wales being less compliant than in previous outbreaks. The compliance is consistent and it's relatively high. Professor Leask is from the Susan Wakehill School of Nursing and Midwifery at the University of Sydney. And if I had to choose between believing a scientist and a politician or a bureaucrat hack, I'm going with the scientist every time. I just am. Call me old-fashioned. Science is the only thing keeping us out of caves, right? And when everything goes tits up, who do they call? Scientists and engineers, not lawyers and politicians. Let's just be crystal. Now, let us talk about masks, okay? As of last Monday, if I walk out onto the street at the front of my home and collect the bins, I am required to wear a mask. Leaving aside the absurdity of this proposition as a COVID countermeasure, like it's a quiet street and there's generally nobody outside for 100 metres, if I run this gauntlet maskless, I can be handed an on-the-spot fine of $1,000 for breaching a public health order. Of course, that would only happen if, I don't know, an incompetent asshole from the Fixated Persons Unit was surveilling me. Don't laugh. They've clearly got nothing else to do but serve at the whim of politicians under the Minister for Strip-Searching Children. If I fight my hypothetical maskless fine in court, the penalty can be up to $11,000 and or 6 months imprisonment. So that's an interesting roll of the dice, isn't it? I guess I could go for a ruling under Section 10 of the Crime Sentencing Procedures Act, but that would be based on the trivial totality of the circumstances, and I guess the decision there would be down to the judge and how irritating his crotch rot was on that day. There's no scientific evidence that wearing masks outside generally is a prophylactic against COVID. There's just not. Don't get me wrong. Masks inside, in public spaces, in shops, government buildings, doctors' surgeries, the foyer of your apartment block, definitely a good idea. Not much of a concession to make. It's not much of an impingement on one's civil liberties, is it? Probably helps inside. According to BMJ, which is a publisher of over 70 respected medical and scientific journals, in a post entitled "Should Masks Be Worn Outdoors?", the expert medical view is wearing masks outdoors, particularly at large outdoor gatherings such as sporting events or other settings where it will be difficult to maintain physical distance for prolonged periods, which may have a low but measurable risk of seeding a super spreading event, as well as normalising mask wearing behaviour in general, will bring benefits in reducing risks during the pandemic phase of COVID-19. I do wish these medical experts would just learn that it's okay to break long sentences up into shorter ones so that ordinary members of the population can digest what the hell they're trying to say. So here's the translation. Wearing masks at large outdoor gatherings where it is difficult to maintain distance for prolonged periods might help a little. And even then, if you're not wearing a mask, the risk of a super spreading event like the recent illegal Maroubra arsehole party is kind of low. The scientific experts cited in BMJ continued. Given the low risk of transmission outdoors, recommendations or mandates for outdoor masking may seem arbitrary, affecting people's trust and sustained energy to engage in higher yield interventions, such as indoor mask use or staying home if sick. If you want to know why they want you to mask up just walking down the street currently, here it is from scientific experts quoted in BMJ. Ultimately, outdoor mask mandates may be popular in some settings as they are among the most visible interventions purporting to demonstrate decisive leadership. So, the recent New South Wales outdoor mask mandate seems to me simply empty spin with a $1,000 on-the-spot fine attached if you get caught not complying. Got to be seen to be getting tough on COVID, nailing society's non-compliant. Something for the police commissioner to talk about at tomorrow's press conference, I'd suggest. Just over a week ago, on August the 20th, new COVID cases in Afghanistan rocketed to a record of 825, which has since been surpassed, obviously. And on that day, August the 20th, 3 people sadly succumbed to the disease. A woman in her 90s in the geriatric ward of Liverpool Hospital and 2 men, one in his 80s and one in his 90s. Now, according to a tweet from New South Wales Health on the 20th, both these men were residents of Greenwood Aged Care in Normanhurst and acquired their infections in the aged care facility. What New South Wales Health did not tweet was this inconvenient detail reported by The Guardian. Both had significant underlying health issues, and perhaps even less conveniently, 6 residents of the facility's dementia ward had been diagnosed with COVID-19 after an unvaccinated staff member worked while infectious. Now, I'm going to put this next bit in straight-talking terms that even a politician would understand, so kindly excuse the French. How the actual fuck can an unvaccinated worker be permitted into the same building as a bunch of society's most vulnerable people? Like, most vulnerable generally by virtue of their age, and most vulnerable specifically in relation to succumbing to this disease. I get that it's illegal to force anyone to be vaccinated, but that's not the same thing as allowing some lazy or outright anti-vax nut to enter a high-risk environment and infect the vulnerable. You might have a right not to get vaccinated, arguably, but you certainly do not have a right to endanger the vulnerable. Like, not morally anyway. Like, why is this incredibly obvious problem not far better addressed at the top? And how is this not a factor for employers under the Occupational Health and Safety Act? That's what it's there for. You know, that part about consequences of your actions at work affecting the public. It's written in. Why has there not been a massive focus on COVID countermeasures for the elderly? And why has this not been extended to other COVID vulnerable outliers, such as those with medical conditions making them vulnerable? Why have our arsehole politicians not hardened these targets? They have had over a year to do so. According to experts, you're not really at any significant risk of getting COVID just walking down the street, at least not according to actual science. Outdoor transmission contributes very little to overall infection rates, and efforts should focus on reducing indoor transmission. BMJ, there again, you are certainly at risk in New South Wales at home, however. If somebody you live with works in a place where the risk of infection pertains, perhaps they're, I don't know, cleaning an aged care facility, or perhaps they are face-to-face with the public all day long at a supermarket or similar. That's a snapshot from New South Wales Health's latest COVID comic. It's actually called the COVID-19 Weekly Surveillance Report. You can download it from the website. It's only 2 weeks out of date, that latest report, because that's how long it takes them to get their shit together. So well done, bureaucracy. The red area, okay? That's the we haven't been able to tell how you got COVID area. The grey area is your case is linked to a known case or cluster, such as the arsehole convention at Maroubra recently, and the Teal area, right? You got your COVID from someone who lives in your home, who contracted COVID outside, presumably while at work or perhaps shopping, because these are the only two things you're allowed to go outside and do. And this is the unpalatable truth, right? Household contacts, they represent 40% of new COVID cases. 40%. Contracting COVID at home is the most common known vector of infection. Hashtag science. It's called a fucking scientific fact. And yet, deafening silence from the useless Premier and her cronies on what countermeasures are deployable on the home front, if any. As an engineer, I'd do it just like making a factory safer, okay? I would seek some data on what jobs those people are doing, which means that they get exposed to this hazard and they come home with the bug. Data, the acquisition of data, is the root of all solutions, okay? And then I would make pretty sure we minimise that kind of work in the community to the extent that this is possible and still have a vestigially functioning society out there. And I would urgently mobilise resources to maximise the vaccination status of the people who have to be out there doing that because it's essential to the functioning of society. This is how risk is managed in the workplace. Like, how hard is it, dudes? You eliminate hazards where it's possible and you employ countermeasures when the hazard is not amenable to elimination. Perhaps there are things people this vulnerable group can do, right? If they're in that group, maybe there are things they can do, like get tested and isolate early if positive, and wash your friggin' hands before touching food or the kids or, I don't know, the TV remote, whatever. Practice better on-the-job safety measures too. Who's auditing that? More social distancing at work, separation plans and things of this nature. How effectively exactly is that being rolled out? Perhaps some actual epidemiologist might develop a list of domestic practices and workplace practices that might work for these people, and if by virtue of some miracle and we all woke up tomorrow with a non-useless Premier and Health Minister at the helm, he and or she might read that list out instead of stuttering ineffective spin like this at the daily COVID briefing. I do not want us to have to look back and say we did not try, we did not put everything into it. Gladys Berejiklian there, reported by SBS News on the 20th of August, and I'd suggest that's a bit rich, Big G. After 8 long weeks of you actually not putting everything you could into it, except these insane penalties and nose-jerk reactions seemingly conceived 10 minutes before each daily pornographic video conference and hastily concocted by a bunch of completely unqualified spin doctors and therefore unsupported by actual scientific evidence and therefore guaranteed to be in-frigging effective. But I'd suggest this statement does at least tell us all rather a lot about how Gladys Berejiklian actually thinks. See, it's almost impossible to maintain a facade live. And this is something I know rather a lot about. To her, it seems to me, as an observer of these things, that it's all about the perception, right? How people will look back and view her performance. It's all about her, baby. And that's A-grade spin right there. You can smell it right here from lockdown, deep in the fat cave. And I'd suggest it's a good thing if we don't step in it. GB does not want you staring in the temporal rearview mirror and thinking that she did not put everything into it. Even though that's exactly what she has done and exactly what she continues to do, frankly. She just doesn't want you to think that, dude. The facts do not matter. Perception is everything. Politics. I've had enough of this export-grade incompetence at the top, I really have. Gladys Berejiklian must step down. Like, give Parrothead a crack until the political machine chews him up and spits him out, which could be quite entertaining to watch given that we're all here, sitting on our asses with not all that much to do.